Metformin is one of the most prescribed medications for managing diabetes, but how much do you really know about its long-term effects? While it's effective at controlling blood sugar, some users have shared alarming stories about the hidden dangers that come with long-term use. In this video, we're diving deep into the 5 long-term side effects of metformin you should know about. Starting our list at number 5 is stomach troubles. Ever wondered why your gut seems to be in so much discomfort? The answer might be metformin, a popular diabetes medication. Many people taking metformin experience stomach troubles. These issues can include nausea, diarrhea, and abdominal pain. While these side effects might seem minor, they can have a big impact on your daily life. Imagine feeling queasy during an important meeting or having to rush to the bathroom in the middle of a family dinner. These situations can be uncomfortable and embarrassing. But why does metformin cause these problems? The medication works by changing how your body handles sugar. This process can upset the balance in your digestive system. As a result, you might find yourself dealing with unpleasant stomach issues. While stomach troubles can be frustrating, it's important to weigh them against the benefits of metformin. The medication is effective at controlling blood sugar levels for many people with diabetes. The good news is that there are ways to manage these side effects. One simple trick is to take metformin with meals. This can help reduce stomach upset. Your doctor might also suggest adjusting your dose. Starting with a lower dose and slowly increasing it can give your body time to adjust. It's important to remember that everyone reacts differently to medication. Some people might have severe stomach problems, while others might have none at all. A study published in the journal Diabetes, Obesity and Metabolism found that stomach troubles are common among metformin users. However, the same study also showed that these side effects can often be managed effectively. This means you don't have to choose between controlling your diabetes and having a happy stomach. It's crucial to keep track of your symptoms. Pay attention to when they occur and how severe they are. This information can help your doctor make the best decisions about your treatment. Don't let stomach issues discourage you from taking care of your health. With the right approach, many people find ways to manage these side effects and continue benefiting from metformin. Stay positive and proactive in your diabetes management. Next on our list, at number 4, is vitamin B12 deficiency. Vitamin B12 is a powerhouse nutrient that your body needs for healthy nerves and brain function. However, long-term use of metformin can lead to vitamin B12 deficiency. Why is this vitamin important? Well, vitamin B12 plays a key role in keeping your nerves and brain working properly. Without enough of it, you might start feeling tired, weak, or even notice changes in your thinking. These symptoms can sneak up on you, often mistaken for normal aging or other health issues. Studies found that people taking metformin had a higher risk of vitamin B12 deficiency. The researchers noted, metformin treatment may lead to vitamin B12 deficiency, which can impair cognitive function, particularly in older adults. But don't panic just yet. Knowing about this risk means you can take steps to protect yourself. Regular checkups of your vitamin B12 levels can catch any problems early. If your levels are low, your doctor might suggest taking B12 supplements or adjusting your metformin dose. So, what should you look out for? Common signs of vitamin B12 deficiency include feeling very tired, weak, or lightheaded. You might also experience numbness or tingling in your hands and feet. Some people even notice changes in their memory or ability to think clearly. If you're experiencing any of these symptoms, it's time to have a chat with your doctor. But here's the tricky part. These symptoms can be subtle and develop slowly over time. You might not even realize there's a problem until it becomes more serious. That's why regular checkups and blood tests are so important for anyone taking metformin long-term. Your doctor might suggest simple steps to help prevent B12 deficiency. This could include eating more foods rich in B12, like eggs, fish, and dairy products. If you're vegetarian or vegan, you might need to consider B12 supplements or fortified foods. Coming in at number 3 is lactic acidosis. Lactic acidosis is a condition where there's too much lactic acid in your blood. It doesn't happen often, but when it does, it can be very dangerous. This problem can occur in some people who take metformin, especially those with kidney issues. But what exactly is lactic acid? It's a substance your body makes when it breaks down carbohydrates for energy. Usually, your body can handle the amount of lactic acid it produces. However, in some cases, metformin can cause your body to make too much lactic acid or prevent it from being removed properly. The symptoms of lactic acidosis can be scary. You might feel very tired, have muscle pain, or find it hard to breathe. Some people also experience stomach pain, feel cold, or have a slow heartbeat. If you notice these signs, it's important to get medical help right away. Now, why does this happen to some people and not others? The answer lies in how our bodies work. Our kidneys play a big role in removing metformin from our system. If your kidneys aren't working well, metformin can build up in your body, increasing the risk of lactic acidosis. A study in the journal Diabetes Care found that people with kidney problems have a higher chance of developing lactic acidosis when taking metformin. The researchers noted, the risk of lactic acidosis increases significantly in patients with chronic kidney disease, especially those with an estimated glomerular filtration rate, eGFR, below 30 milliliters per minute. This might sound alarming, but don't worry. Lactic acidosis is still very rare. Most people who take metformin never experience this problem. However, it's important to be aware of the risk, especially if you have kidney issues. So, what can you do to protect yourself? Regular checkups and blood tests can help catch any problems early. It's also important to tell your doctor about any other health conditions you have. Some illnesses, like liver disease or heart failure, can increase your risk of lactic acidosis. Another crucial step is to follow your doctor's instructions carefully. Take metformin exactly as prescribed. Don't change your dose or stop taking it without talking to your doctor first. It's also a good idea to learn the signs of lactic acidosis. If you ever experience severe tiredness, muscle pain, trouble breathing, or stomach pain, seek medical help right away. While lactic acidosis is a serious concern, it's important to keep things in perspective. Metformin has helped millions of people manage their diabetes effectively. For most people, the benefits of taking metformin far outweigh the risks. Nearing the top of our list at number 2 is decline in memory and learning. Recent studies have revealed an unexpected link between long-term metformin use and something we all rely on daily, our memory and ability to learn. You might be wondering, how can a diabetes medication affect my brain? Well, it turns out that the relationship between metformin and cognitive function is more complex than we once thought. A study published in the journal Neuropharmacology found that while metformin might help some aspects of brain function, it could also have some drawbacks. The researchers looked at how metformin affected mice of different ages. In younger mice, metformin seemed to help with attention and learning. But in older mice, it actually made it harder for them to remember things. This is important because many people who take metformin are older adults. The effects seem to depend on factors like age and how long you've been taking the medication. Some people might notice changes in their ability to remember things or learn new information over time. Here's what you should keep in mind. If you've been taking metformin for a long time and start to notice problems with your memory or thinking, it's worth mentioning to your healthcare provider. But don't panic. These findings don't mean you should stop taking your medication. The goal is to find the right balance between controlling your blood sugar and protecting your overall health, including your brain function. So, what can you do to keep your mind sharp while taking metformin? First, stay active, both physically and mentally. Exercise and challenging your brain with puzzles or new hobbies can help maintain cognitive function. Also, eat a healthy diet rich in fruits, vegetables, and omega-3 fatty acids, which are good for brain health. One interesting aspect of this research is how it highlights the complexity of our bodies. As science advances, we're learning more about how medications like metformin work in our bodies over long periods. This knowledge helps doctors make better decisions about treatment plans. And finally, the number one on our list is the Alzheimer's connection. What if the medication you've been taking to manage your diabetes could actually increase your risk of Alzheimer's disease? Recent research has uncovered a troubling link that might make you rethink your treatment plan. A study in the journal Translational Psychiatry has shed light on a potential dark side of metformin. This widely used diabetes medication might be increasing the risk of Alzheimer's disease in some patients. The research, conducted on transgenic Alzheimer's model mice, found that long-term metformin use led to higher levels of amyloid beta oligomers and plaques in the brain. These are key markers of Alzheimer's disease. But what does this mean for you? Well, amyloid beta plaques are like sticky clumps that build up between nerve cells in the brain. They're a hallmark of Alzheimer's disease and can interfere with brain function. The fact that metformin might increase these plaques is cause for concern. The study also found something worrying. Metformin treatment significantly raised levels of phosphorylated tau in the brain. Tau is a protein that helps stabilize the structure of brain cells. When it becomes altered, it can form tangles inside brain cells. These tangles are another key feature of Alzheimer's disease. This research is groundbreaking. As the study states, chronic metformin treatment exacerbates A-beta and tau pathologies in AD mice. In simple terms, this means that long-term use of metformin made Alzheimer's, like changes worse in the brains of mice predisposed to the disease. So, what does this mean for you if you're taking metformin? First, don't stop taking your medication without talking to your doctor. Metformin is still an effective treatment for diabetes, and the risks of uncontrolled blood sugar are well known and serious. However, this research does suggest that we need to be more careful about how we use metformin, especially in older adults or people with a family history of Alzheimer's disease. It might be time to have a conversation with your doctor about your long-term treatment plan. Your doctor might want to consider your individual risk factors for Alzheimer's disease when deciding on your diabetes treatment. They might also recommend regular cognitive checkups to monitor your brain health over time. This discovery also highlights the need for more personalized medicine. What works best for one person might not be ideal for another. Your age, genetic makeup, and other health conditions all play a role in how medications affect you. It's also a reminder of how complex our bodies are. A medication that helps one aspect of our health might have unexpected effects on another. This doesn't mean the medication is bad. It just means we need to look at our health as a whole, not just focus on one part. This research is pushing scientists to look for new and better treatments. They're working on developing medications that can control blood sugar without potentially increasing the risk of Alzheimer's disease. In the meantime, there are things you can do to support your brain health. Eating a healthy diet, staying physically active, keeping your mind engaged with learning and social activities, and managing stress can all help protect your brain. And there you have it. We've uncovered some surprising long-term effects of metformin, from stomach troubles to potential cognitive impacts. It's crucial to be aware of these risks, but remember, metformin remains an effective diabetes treatment for many. We'd love to hear from you. Have you or someone you know experienced any of these side effects from metformin? If so, share your story in the comments below. Your experience could help others. If you found this video helpful, please give it a thumbs up, subscribe to our channel, and click the bell icon to stay updated with our latest health tips and information. Also, if you found value in this video, please consider sending us a super thanks. Your support helps us create more informative content for you. Thanks for watching. Stay healthy and take care.